Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?
Well, hello, everyone. Welcome to the Think Small podcast, where we bring the stories of leaders who are building something hard in small to mid-sized companies. I'm your host, Denise Steinbring, and today we're talking with Tara Good-Young, the CEO of PDI Surgery Center in the North Bay. PDI is the only surgical facility of its kind in the region, dedicated entirely to children and special needs patients who can't get care anywhere else. I just love this mission. That's very profound and a very hard business model also. So welcome, Tara, to the podcast.
Thank you for having me. I appreciate getting to be on this great podcast, which I've been a fan of listening to myself. So it's really exciting to be a part of it and share in that community.
Wonderful. Well, let me start by letting you fill in the blanks for our listeners. Tell us a little bit about your background and what PDI does and anything else you think we should know about the work you're doing.
Absolutely. PDI Surgery Center has been around since 2009, and where it came from was the Pediatric Dental Initiative, hence PDI, seeing that there were a lot of children under-resourced across Northern California that weren't getting care. Hospitals were not able to take up that demand. It did not fit for the way that they were tooled in their med-surg operating facilities, and that eventually ended up developing some partnerships and community collaborations that brought PDI Surgery Center into being. Since 2009, we've treated 32,000 children and special needs patients. For myself, I have been in healthcare for 30 some years. And that takes us back to healthcare before there was the ACA, meaning that children that were born with congenital conditions were considered prior existing conditions. So the fact they were born gave issue to the fact that they may not be covered by standard insurances. So many of them were on Medicaid programs, state payer programs. And this gave me a lot of empathy for trying to find access to care, both in suburban, urban, and rural areas. So I became quite an advocate for families that had access barriers and trying to connect them to appropriate team care, and also appreciating many times the distances that they had to travel to go receive care. When I started in Northern Nevada, many specialty patients had to travel all the way down to LA to get the specialist care from pediatric cardiologists, endocrinologists, etc. So I really had a passion for helping people get the care that they need and understanding where healthcare really plays a part in everyone's life cycle and their well-being overall in a community. And that's what eventually drew me to PDI when they were looking for a CEO that had a background in pediatrics, under-resourced patient demographics, as well as running surgery centers and also knew dental and oral health. So I threw my resume, as they say, threw it into the hat, and they selected me, and it has been a really incredible journey thus far, and I've got an amazing, very dedicated team.
That's wonderful. And when you say that you kind of grew up in healthcare, are you a nurse? Are you a clinician by training? Did you know the business side? Tell us a little bit more about your background.
More so, I knew the patient advocacy and business side. So I grew up in a family of physicians, as well as that put me in a community of physicians and healthcare providers. So I got to see them carrying on their craft and caring for people. Also, many times the struggles that they had being able to care for their patients, especially as we saw managed care develop, and a lot of the different things about networks of where people could or could not be seen and getting prior authorizations, all of those things, and patients being a bit, if you will, bamboozled by all the jargon that comes up in the healthcare industry that is there, although supposed to be, if you will, a basic human need is access to healthcare. So we had this barrier between geographical, financial access, and also informational access, understanding and comprehending what you needed, how to communicate with your doctor, your provider, your insurance company, so that it could all come together for you to simply get care. So I learned that my strength on the business side was helping bring those three groups together, the insurance, the patient, and the provider, so the patient could be treated. And the provider's office, especially in small areas that lack other care, they may be the only resource, making sure their doors stayed open so that we didn't have a new healthcare desert show up.
Yeah. Wow, that's just fascinating. I'm so pleased that you've treated 32,000 children. That's great. So you're running the only facility of this kind in the North Bay, right? A surgical center dedicated entirely to children and special needs patients who can't get care anywhere else. That's both a very profound mission and a very hard business model, because your patients are vulnerable and complex, your payers are the least reliable, and your operation has to meet hospital-grade standards on a nonprofit budget. So walk us through how you actually make that work financially, and what has that taught you about running a lean, mission-critical organization that other small business operators can take from?
Absolutely. It is a challenge, but of course, we have the passion behind our mission that makes it all worth it, and that we need to be resourceful and flexible. But essentially, we make a hospital grade surgery center work on a nonprofit budget because we are resourceful by design. PDI chose to be a disruptor in a broken system. That earned us support from hospitals and health systems. They didn't see us as competition. They saw us as a relief valve for a community need that they just really weren't built to meet. That collaboration is part of our sustainability. And at the core, we were built to fix a massive access failure. Under-resourced children, patients with special healthcare needs often had no other option within an 8 to 10 hour radius. And that radical mission clarity really helped keep us disciplined. There's no mission drift. We have no vanity projects. We stay focused on why we're here for the patients that really need us. So operationally, we run lean and resilient. We have to design tight schedules. We have standardized workflows, cross-trained teams, so you have flexibility, cross coverage. You're just staffed enough so that you can maintain all of your business and clinical operations without having too much excess that you can't balance the budget on. But you've got to maintain having a little bit of flexibility because, of course, as we know, people are human. They need to have time off. Their illnesses come up, other interruptions. So you have to have enough coverage in that team, staffing appropriately to keep yourself moving forward, planning for disruption. And we maintain multiple vendor relationships to protect pricing and ensure access to mission-critical supplies. If COVID taught all of us anything, it's that just-in-time ordering can shut down a business. For us, it can shut down care. So efficiency is strategic. It protects quality and it helps keep our mission moving forward. And then as you pointed out, payers. We are predominantly working with Medi-Cal payers, whether it is straight Medi-Cal or their managed care arms. These funds alone, because it is not like, say, a larger hospital where you have a varied payer mix of multiple commercial payers. That is where we do have one built-in weakness. But that is the demographic that needs us. And it's that we provide care to predominantly Medi-Cal payer patients. We are about 96-97% Medi-Cal patient driven. So we have to stay diversified in other ways. We look at grants. We write for a lot of grants. We build relationships for philanthropy and partnerships with other healthcare partners or grantors. That is our supplemental financial engine to give us some resiliency. That's how we subsidize care for the kids who need us most, but may find themselves in these gaps where maybe they don't have Medi-Cal coverage or they've got a portion for medical, but not for dental, so that we can make sure that they still are taken care of. And we have to plan for volatility. volatility. We have to assume cuts and changes in economy can always be coming. So we build our lean systems, we maintain alternate resources, and we do keep a rainy day fund in an interest-bearing account to bridge disruptions that will give us time to pivot and make alternate plans for, say, Plan B, to figure out how to mitigate those impacts. So in a snapshot, we run a hospital-grade surgery center with startup discipline. We can't control Medi-Cal cuts or the economy, but we can control our efficiency and quality and how resourceful we are. Every dollar has a job. Every process has to protect both safety and sustainability. And I would say the lesson for any small businesses, it's simple. Build and maintain your relationships. Sustainability and visibility require partnership support. It takes a village really comes to mind. And use your operating constraints to firm up your mission and business clarity. They make you innovate, prioritize, and eliminate anything that doesn't serve the mission, because that's waste and you cannot fund waste. If it's not serving you, if it's not serving your patient or your service population, your intended client, and maybe that's not where you need to be investing or using your dollars.
Wow, this is one of the best business continuity conversations I've had on this podcast. It sounds like you've got everything ticked and tied.
That's what 30 years in healthcare survival will give you.
Exactly. Have you had any impact from, we're hearing a lot in the news about Medicaid fraud and, things that are getting held up by the government while they're investigating providers and things like that. Has that impacted you at all?
Not, quote, directly yet. Where there is some impact is, say, our referral partners. The patients that we see usually are discovered through medical or dental providers that are also taking Medicaid, Medi-Cal. So if they have felt decreases and impacts, sometimes that impacts their ability to deliver the wider patient services or the number of patients they can see. So it can be a trickle down. One of our worries that we're seeing is that there are some smaller hospitals in Northern California that they themselves, one in Glenn County already has filed to give notice of closure. So these will create larger patient deserts, which means patients have harder access to find care providers who then may discover them and get them referred for the appropriate care that they need, including down to us. Where we are potentially seeing a struggle is in our state of California budget as being impacted by some of these things. Mm-hmm. So in trying to balance that budget, one of the things under consideration was a very significant cut to reimbursement to dental providers through Medi-Cal Dental. They are proposing a 35% reimbursement rate cut, being that we're already only being reimbursed about 33 to 38 cents on the dollar that we bill, and seeing it go down to potentially about 22 to 21 cents on the dollar. When I took a look at projecting our budget, if that cut were to go through, we would be looking at a $1.7 million deficit for our surgery center, which we know there are not going to be any sudden donors that come up overnight that can bridge that gap. So we have spent a lot of time with coalitions and myself going to the state and advocating and speaking with legislators so that they understand the impact that this could have on a child's life that will follow them all the way through adulthood. As we know, if permanent teeth are damaged or missing, when we look at adulthood, depending on where you live and what employment opportunities are available, you can be 4 to 15 times less likely to have sustainable employment. And that is where most people get their benefits, their healthcare benefits. Of course, that's how they maintain their own lifestyles, households, etc. So things that we do to children now that can't be walked back can affect them their whole life, and that impacts a whole community's wellness. us if we trap people in a cycle of poverty because they cannot stay sustainably employed.
Gosh, well, I'm glad that they've got you as an advocate because I can tell the passion in your heart.
Thank you.
Well, you shared with me previously about AI as one of the most significant opportunities right now, specifically around data analytics and improving the speed and clarity of operational decision making. For a small healthcare company like yours, where resources are tight and margin of error is literally a patient safety issue, how do you think about adopting new technology?
So, in thinking about AI, clearly it's a topic on everyone's minds of how does it fit? What's appropriate? Is it affordable? Will it help or hurt? Can I trust it? So, I too consider all of those things because it is a great new and evolving tool. So with that, I think about, where does it fit for us? And I see AI as potentially an excellent clerical and administrative assistant for small organizations, including ours, but only when it really enhances safety, efficiency, making sure that it's not replacing judgment. Because while we call it AI, artificial intelligence, it really at this stage is learned intelligence. It's only as strong as the data it's been trained on and the feedback it receives. So that means accuracy and security, those risks are really real. Garbage in, garbage out comes to mind, and that still applies. You have to understand its limits, you've got to check its work, and you've got to train it just like you would a new staff member. And so we are looking at utilizing AI, but where it's going to reduce administrative burden, improve some accuracy, and strengthen compliance. We avoid anything that could compromise our patient communication, safety, or clinical decision making. Where we see AI valuable at PDI is automating administrative tasks, editing and drafting policies or reports, and also analyzing de-identified operational data, which is important because you have to remember that in open AI, it is learning from your data, and that data means it could become publicly available. So that's a point that people really need to keep in mind. Where we're not using AI or we don't feel that it's appropriate yet is we're not using it for patient communications, clinical decision making, or anything that really requires human expertise. In healthcare, we are still going to see it as a tool, not a clinician or a replacement, where human touch, nuance, and empathy are really core to care delivery and our patient satisfaction. One of the places where we were thinking about it, but then deliberately chose not to use AI, was an AI phone assistant. Because at this stage in the game where I was encountering some myself as the client, as the user, is that when my experience made me frustrated and felt like there was a disconnect with me in the business or service I was trying to access before they've gotten to us. So we don't want them interacting with a technology that's not quite ready to serve them in a way that we desire, and it potentially adding a challenge for them. And then getting back to that security risk. Many are still really enamored with its ability to quickly sort and summarize information. But you have to remember and respect that, again, as I mentioned, it's learning from your information. OpenAI is not a closed or confidential system. You need to have staff training and clear guardrails about what can be entered into a publicly accessed system. Governance on how to use the tool is just as important as the tool itself. Information security is why we see many organizations these days building their own private AI applications to serve them in-house, keeping a closed loop on their data.
Right, right.
And then when we consider using any new technology, we ask ourselves three things. Does it improve safety, accuracy? Is it going to reduce burden? Will it improve job and patient satisfaction? And my advice to any small business leaders considering any tools, and especially AI tools, start with your pain points that drain your team's time and don't chase shiny objects. It's very tempting to want to be the first, get the newest thing, but make sure that you really review how it works, what the hazards are, what the potential ROI is, and use the appropriate AI tools to free your people to do the work only humans can do.
Right. No, I love that point you made about the AI phone assistants, right? Because at the end of the day, AI is smart, but it doesn't have emotion, right? And it still requires that human oversight to make sure things are accurate, to make sure that people feel seen as individuals, right? And not just as a transaction, and especially in the line of business that you're in. So I think you're spot on every point that you made on this question.
Absolutely. I wanted to bring convenience so you don't have people necessarily on hold or waiting.
Right.
However, I experienced the other side of the coin of while that it was trying to engage you, it wasn't always accurately engaging you. And I was so frustrated by the time I reached a human being that it wasn't helpful. And so if I imagine myself trying to access healthcare, I'm trying to get something for my child that I'm already worried about, I don't need something to agitate me further when I'm already stressed. So I felt like this was just not the time and the tool for us yet.
Exactly. Well, you're accountable to a board, to donors, to grant-making foundations, to Medi-Cal, to some private insurance, and to your community all at the same time. And all of those stakeholders have different definitions of success. So for some of our listening audience, a founder or a business leader who's trying to grow a company while staying true to a mission that doesn't always fit neatly into a P&L, what have you learned about how to hold those two things together without letting one destroy the other?
Indeed, we hear a lot, especially when we talk about nonprofits. We hear the term no margin, no mission. And it really is true. You have to take a look at, because of that, the mission and the margin aren't opposites. They're interdependent. The mission gives us our purpose, and the margin gives us the ability to deliver on it. And my job is to protect both with transparency, discipline, and data, regardless who I'm answering to or advising. And when we get to no margin, no mission, we want to make sure that if we have no mission, we would have no reason to exist. Margin allows us to make sure that we're delivering on who we need to provide services to. And with that, there's the reportability of how it's being done. How do we balance it? And we balance these two items, the margin and mission, by being transparent, staying data-driven and disciplined. There are times that we do take short-term margin hits because the long-term community ROI is undeniable, but we also operate strategically to know when we can balance that loss out responsibly and not imperil care delivery or our ongoing operational sustainability. And then I have to define that success for each different stakeholder when we take a look at the success of holding a margin, delivering on a mission. For donors, success is impact. They want to know how their dollars were used. How many people did it help? Did it make a difference? Is it serving the program versus administrative costs? Things that I think all donors ask themselves about what happens with their money. Did it stay in their community? What then was the overall impact to their community, hopefully for the good? And then for Medi-Cal and our payer partners, it's patients in need being served, avoiding preventable hospital encounters for dental-related infections or developing chronic disease. For our safety and surgery center and accreditation outcomes, it's compliance and making sure that we are meeting all of those needs. And I've got a team that is following and living in compliance. And for the board, sustainability and mission delivery. They want to make sure that while we are being efficient, we are doing it while we are holding true to who we want to serve and how they're being served and the dignity of it. And for our families, that to me is my ultimate stakeholder. Mm-hmm. That's why we're here, for the families, their children, and their members that have special health care needs that can't be treated in a standard dental facility. We have to provide safe, compassionate care. And I focus on communicating those mission metrics to each group that is invested in them so that they are hearing predominantly the focus segment that they want to know about, and then adding additional details as required, but making sure they get the answers to what most interests them. And to operate with transparency, we share our outcomes, financials, and operation metrics only. People can find our impact reports both on our website and places such as Charity Navigator. When people see the numbers of patients we've served with the resources that we have, they really understand the constraints, and it builds more trust in the decisions that we're making, especially when it comes to the grant money they've given us, the donations, the foundation funds, and also just the patient trust and our referral partner trust that they feel safe and confident sending their patient to us to do the treatment that they cannot complete for them. And we also hold a line on unsustainable requests. We need to make sure that we have minimal scheduling requirements for each OR because we also need to have appropriate staffing to patient ratios and make sure that we are being financially responsible as well. And as much as we always want to say yes to taking care of patients that need us or have been referred, we do have to say no to cases that compromise safety. If they're not medically appropriate to be treated in our outpatient surgery center, we do have to say no. I never want to do a patient a favor and end up doing them a medical disservice. It would be completely inappropriate.
Yeah.
And that shakes the confidence of everyone around you if something that shouldn't have happened happens because you didn't hold strong boundaries to protect your mission and your guidelines. And we build a culture that understands both sides. Our team knows that every efficient process, every grant written, every dollar we receive translates into another child that is treated.
Yeah.
And my founder or leader takeaway, my startup partners out there are people, really pushing that new small business. If you don't protect your mission, that money won't matter. And if you don't protect your money with your guidelines and having boundaries as well, the mission won't survive. So you have to lead with both hands. And it is okay to feel that tension. It's just making sure that you're doing it with the best integrity you have, with the information that you have at the time to make those decisions. And that's where having your guidelines and SOPs will really help you. And making sure that they are always aligned with your mission. What is your ultimate objective? Who is your ultimate customer? What's your goal?
Well, gosh, Tara, you've built something that most people would say is impossible, and you're leading with grace and grit. I think I'm going to buy you a superhero cape. But, this has been one of the most grounded and honest conversations I've had about the real economics of mission-driven work. So thank you so much for being willing to talk about what's actually hard, not just inspirational. For people who want to learn more about you or the work you're doing there at PDI, where should people go?
You can pop on over to our website, which is pdisurgerycenter.org.
Great.
And we have an About Us section. You can learn about our team, see examples of what we do, and you can go into our impact sections to see over the years what we have done as far as treating patients and our impact. But also one of the things that we pride ourselves on as well is while we are also there to resolve the problem when patients have severe dental decay, we are also working to try to be part of educating on prevention to prevent the problem. Yeah. So you'll see where we have performed a lot of outreach to schools, community programs, education centers, early child care to educate educators, child care providers. Children themselves get very involved, which is really fun, as well as their parents on home hygiene, the importance of seeing a dentist, nutritional and dietary choices, because we want to make a healthy community by being part of knowing how to best take care of yourself. And then if something has gone awry and you still need us, we of course want to be there to treat them too.
That's so amazing. Well, to our Think Small listening audience, if today's podcast made you think differently about how to build something hard while staying true to your mission, or about how to make lean operations work when your margin is compressed, please share this episode with somebody on your team who needs to hear it. That's the way we grow this conversation. Thanks so much for listening. Thank you, Tara, for sharing all of your wisdom. I wish you much success in fighting on the Hill for and being that patient advocate. You're doing amazing work. We appreciate having you on.
Thank you. I appreciate you, and also have to give a big shout out to my team and my board because I don't do the work alone. The Pediatric Dental Initiative established the surgery center. I have just been so fortunate to come on and become the caretaker of it, the steward in the last 3 years. And I have an amazing team of just your general staff, but also our nurses, RDAs, dentists, and anesthesiologists that all pull for the same mission. And if that's the biggest takeaway I can give to small business owners is, have a team that is all pulling in the same direction on your mission that you have determined that is worth the grit and the grind that will get you through the hard days.
Those are great parting words. Thank you so much for your time. It's been a pleasure getting to talk to you today. Thank you.
Thank you.
Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?